Healthcare remains at the forefront of this election season. As voters take to the polls, it's important that they understand what's at stake for their family's future. Connecting Point's Dara Kennedy spoke with a board member from the University of Connecticut Health Center, Dr. Kenneth Eileen, to shed light on national and local election implications.
There is a paucity of federal leadership, and that has been the major challenge, I think, to this pandemic. We have 50 states essentially fighting 50 battles against this pandemic. Imagine if you were fighting a war as the United States. You wouldn't have a 50-state response, right? You would have a centralized response, and that's what we need for this pandemic.
I know that you were on Governor Ned Lamont's reopening program there in Connecticut. Can you just kind of walk us through what that meant as COVID had, basically sidelined most people's professions, economics, the schooling system? What were some of the strategies you guys implemented to safely reopen? And now that the COVID cases are going back up, what happens next?
So that's an excellent question. Connecticut is very fortunate that by and large, we are a economically sound state. But at the same time, we have tremendous disparity. Connecticut has one of the largest achievement gaps in the country for education, which most people would find very surprising. And that's because we have tremendous wealth, but we also have tremendous poverty amongst us. The reopening committee was about how do we safely reopen the state, taking into account all of the various constituencies that need to be addressed when reopening a state: education, business, healthcare, seniors, state government, community-based services. So it was a holistic look. And what we found was that, of course, there were a tremendous number of individuals who the biggest challenge they had was standing in the Whole Foods line, and maybe Starbucks was closed for 3 weeks. So those folks didn't quite need the same amount of focus as the individuals who may not have had access to health insurance, our frontline workers who couldn't get to their frontline jobs because of transportation, our frontline workers who may have not had the opportunity to safely quarantine if they came in contact with this disease because they live in multi-generational housing where there may be far more people than there are rooms. So we needed to make sure that we drill down to make sure that the equity was the lens through which we were looking at reopening the state, while keeping in mind the importance of the business community and other services that have to happen in order for a state to function.
We're in such a precarious situation in this region of America. Our numbers just across all of these states where our viewers are in, obviously it started really badly with New York being the anchor, but this entire region did really well cleaning it up. And it's a testament to like what Governor Lamont was doing to reopen. But now, as I speak to you right now, 38 states in our country are now surging with cases again. Over 8 million people are infected. But yet some schools are still opening and people have to go to the polls. From your expert opinion, Doc, what can families do? What can voters do to protect themselves and their families right now?
The process of protecting yourselves and your family has never changed throughout this pandemic, right? It's about social distancing, wearing a mask, good hand hygiene, and maintaining the common sense moving about a community. Within New England, which obviously has a huge variation of both geography, density, demographics, socioeconomics, there generally has been a very sound response as the governors in the Northeast have worked well together. But yet within that, you see pockets where there are individuals who simply don't believe that this virus is real and that it can make you very ill. The only way to protect yourself is to use the same strategies that have been suggested since last March when we first got our arms around this virus. Nothing's really changed. I think most public health officials are not surprised that we're starting to see a surge. What's compounding that is now for many states, you have college students who are coming from all over the country, and despite good attempts at testing, they're now there. Schools are reopening, which are putting multiple generations sometimes of people together, right? You have teachers and young students, middle-aged students. All this together is why we're seeing a surge now.
This is important because I want to turn to healthcare, as right now there are free testing sites throughout our region. There's no implication for healthcare. You're not going to expect a big bill just to go get your test and your antibody tests. But that could all change, right? The second week after the presidential election, Obamacare, known as the Affordable Care Act, will be up for vote in the Supreme Court. I know that you, in addition to your practice, you are also helping to fund an important campaign that will kind of help protect the health coverage of millions of Americans. Kind of explain to us what you're doing on that front.
Well, there is a inseparable reality between politics and sound public policy, and in this case, public health. The Affordable Care Act provided 16 million people access to health care who didn't have it before, through both lowering the cost of accessing health care and through Medicaid expansion. The potential overturn or revocation of the Affordable Care Act, I personally believe, will be devastating for millions and millions and millions of individuals in the United States, inclusive of those families who have young people who are able to remain on their insurance till the age of 26. I've been working steadily both with the Biden-Harris campaign and with hopeful to be the future senator from South Carolina, Jamie Harrison, because we know that putting the right people into Congress and in particular into the Senate will help to change how that body thinks about healthcare, will help to change how that body wants to interact to offering healthcare to all Americans. There's this Republican meme that we're looking at a single payer, or that it's to overturn your healthcare or to remove you from your patients or from your physician. And I can tell you, as a provider who sees thousands of patients a year, none of my patients have lost access to me, but a great number have gained access to me because of the Affordable Care Act. So this work that we're doing with Senator Harrison is about getting him into that Senate to help control the Senate, flip the balance of the Senate, to make sure that sound policy is available for all Americans and their health care.
Yep, and that Jamie Harrison seat, of course, is on the local level there in South Carolina. But like you said, the implications are vast for all Americans because that will help put Democrats into the majority. And as Lindsey Graham sits atop of that Judiciary Committee, he has so much power. And while we're not in that southern region, that power trickles down to us and the decisions that we have to make on healthcare and the economics for our families. And I know that gets confusing to people as they go out to vote. They're thinking of their local level. Just kind of explain, I mean, and I know it seems basic, but just kind of explain why it is important to not just vote for the president on November 3rd, but to check all of those local boxes.
Absolutely. One of the ways that we are where we are in regard to our current politics, and this is really not to try to address one side versus the other, but the reality is that the Republicans for many years had a very strong focus on the local level. I mean, they were focusing on dog catchers and postmasters and school superintendents, and that they would be the future politicians, Republican politicians, that would come up through the state apparatus, used to take over the state house, governorships, and policy comes along with that. Well, what's happened with the Democratic Party is that for some reason, we tend to get really fired up about national elections or big significant regional elections. Like I'm sure you're aware that Jamie Harrison has raised record amount of money. But it's those local elections that really affect where policy happens. It's those local elections that are going to have the pressure to put the right police chief in charge of the police department. It's the local elections that are going to make sure that there's a superintendent that's responsive to families. So, I implore everyone to vote, despite your party affiliation, but in particular, focus and to get out for those local elections, because that sets the tone for what happens statewide and ultimately nationally.